Hi, Veronica. How are you doing?
I'm doing good.
That's good. How was your day?
My day was pretty good. I played basketball. I was the only girl.
Oh, that's
five
fun.
on five.
Nice. You score any points?
No.
No. Oh, that's all right
They
though.
were too good.
So how you been going since I last seen you?
I've been pretty good. I've just been trying to work out every day and stay healthy. And I'm trying to eat healthier now
Okay.
than I have before.
That's good. I know school just got out. How are you doing without having to go to school every day?
Whew, it's very strange, and I'm not sure what to do with my time.
You haven't found anything to do with your free time yet?
Not yet. I mean, I've been trying to make a book for my husband of our first year of marriage.
Oh, that's cool. So y'all just had your anniversary?
Yes, our 1 year anniversary.
Oh, that's awesome. Congratulations.
Thank you.
That's a good accomplishment.
Thank you.
Cool. Well, thanks for meeting with me today. We're going to go over a couple forums and just some of your things you've already submitted to me. So let's get started. The first thing we're going to go over is the informed consent form. This is basically just a paper that explains what we're going to be doing, how we're going to be doing it, potential risks, the benefits. It explains how all your information is going to be confidential. So I'll let you have this, and I'll breeze over it real quick. Feel free to ask questions at any point if you want to ask something specific, or if you want to sit there and read it yourself. Feel free. We can start with the purpose and explanations of procedures, which is the first bullet there. Basically, if you sign this, you are consenting to the voluntary test to determine your cardio and respiratory fitness. We're just going to do a couple tests to see where you're at on those, so we know how to improve and get you where you need to be if you're not where you need to be, or improve. During those tests, we're going to take a couple samples of your exhaled air to measure the oxygen consumption. So basically, we're going to hook you up to this weird machine. You're going to have this tube coming out of your mouth, and it's going to check and see how much oxygen you're exhaling while you're doing the exercises. So it's going to measure how much oxygen your muscles are using efficiently. So that's how we check and see how well your muscles are using the oxygen. And then we're also going to do a small prick on your finger to do a blood chemistry analysis. It's going to tell us what your cholesterol is, what your glucose is. Have you ever had that done before?
I have not.
Yeah, so a lot of people have never done it, so they have no idea if they have great cholesterol, or maybe they're slightly high on their blood glucose. So just a good thing just to do, so we know if there's any issues that we need to address before we start working out.
What if there's something wrong?
If in case there is something wrong, we will take into special consideration just to keep you safe, especially during the lab tests, like the stress tests and the VO2 max tests, just because we want to keep you safe. So we'll take that in consideration if there is something fishy in your blood tests. Also with that, we're also going to keep that in mind if you have super low blood sugar. We'll keep that in mind when we're doing workouts. Make sure you eat before. So it's just giving us a heads up. That way we know how to plan accordingly in the future. After the lab test, there will also be a fitness assessment that'll do strength, flexibility, and body fat, just so we know where you are strength-wise and flexibility, so we know what you need to improve on. Maybe you want to get better in something you didn't even know. So that's the point of those tests. During these assessments that we're going to be doing over the next couple of days, I'm going to do my best to determine if there's any reason that anything will be unsafe, and if we shouldn't do any particular tests. So if you could be as honest with me as you can, that way I can make the best judgment I can to keep you safe during these tests. So just be honest with me.
Question.
Yes.
What if I don't want to do the body fat, the skin fold pinch?
That's fine. We can. That's just the standard fitness assessment that is included in it. But if that's not something that you are interested in or want to do right now, we can put it off until 2, 3, 6 months from now, or if you want to do it at all. If that's not something you're interested in, we don't have to do it. It's not a necessity.
Because sometimes it's more discouraging than
absolutely
encouraging.
Yep. So, but after working out, I might have you do it just to show you how much you've improved. So it'll make you feel good about yourself. All right. The stress test that we're going to do will either be on a treadmill or a bicycle. So if you have any preference on that, do you like to run or bike? Are you current on any of those?
I like to run. I run either a mile or a mile and a half each time I go work out.
Okay. So we'll put you on the treadmill. The test, it increases in speed and also elevation, so the degrees at which you're running. So you're running up a steeper hill. It increases as it goes up, so it's more difficult as you go on, so it stretches you out quicker. And like I said, you'll be hooked up to the VO2 max machine, which is the volume of oxygen consumed. So that's how that's going to work. And if any point during these tests, just to let you know ahead of time, if at any point you feel discomfort, shortness of breath, fatigue, and you feel like you need to stop or you want to stop or you just don't want to do it anymore, at any point you just give us the word and we will stop right there, because ultimately we want you to be safe. So like I said, if at any point you're not feeling comfortable with the test or you're having a hard time breathing, just let us know and we'll stop the test at any point that you need. And during the test, you'll also be connected with electrodes to an EKG machine, which is an electrocardiograph. Basically, it's just going to monitor your heart while you're exercising. As you know, whenever you exercise, your heart rate goes up and your blood pressure goes up. So it'll measure the increases in your heart rate just to make sure everything's going okay. If there's any issues, maybe we'll find it, hopefully, and help. We'll be monitoring that very closely in order to keep you safe while we're doing the tests. You have any questions so far?
No.
All right. Let's move on to risks. There are some risks with stress testing, just because we will put you under stress that is not normal, everyday kind of stress. We will be trying to get you to close to your limit of what you're capable of doing. Obviously, we don't want to push you there because it's quite uncomfortable, and most people don't make it just because it is that uncomfortable. But some of the risks do include abnormal blood pressure, sometimes fainting, and sometimes heart rhythm issues. And in some cases, very rare, are there heart failure, such as heart attacks. There is a statistic that 6 out of every 10,000 participants do die during these assessments, but that's less than 1% of people. That's actually 0.06% of people. And that's just a general statistic. I know you're in your 20s, and you said you work out quite frequently. You do a lot of cardio, so you're probably significantly less likely for that to happen, but just so you know that there is a possibility of that happening. And there's not only risks, but there are benefits to it. Some of the benefits do include that you are more aware of your blood pressure, also your cholesterol, which you say you never had tested before, so it's good to know where you're sitting at with your cholesterol. We're going to measure your weight, and also we're going to do your respiratory function and the condition of your heart. And I'm sure you've never had an EKG done before, so it's actually kind of cool. I did that a couple years ago whenever I was 21, I think, and it's kind of cool to see how your heart beats on a piece of paper. I mean, you see it on the movies all the time, and you hear the beep, beep. So it's kind of cool to actually see your heart in action. So.
Yeah, because I watch a lot of Grey's Anatomy.
Yeah, so I'm sure you're quite familiar.
They're like, he's coding.
Yeah. Other benefits, not only of the fitness assessments, but of the exercise program. It can help lower blood pressure, which that's probably not an issue, but if it is an issue, it'll help you control your blood pressure and help you lower it. It can improve your cholesterol if there's an issue with the cholesterol. It increases your respiratory and cardiac function, and it also improves overall strength and flexibility. So we're on a road to a good thing here. The confidentiality, if you do sign this, basically it's just saying that all your information is privileged and confidential, and we will not release any of your information to anybody unless we have expressed written consent, and then we're only allowed to release it to who you expressed to. So if you want to take these results and let us send them over to your doctor so he has them on file, just so if something happens, he can look into it and he knows what's going on more about you, because, I mean, you're getting this for free, and you'd have to pay if you went over there to do it with him, so it's nice to kind of share that information if you wish to. And the release, like I said, we're not going to release anything unless you sign for it. And if you have any more questions?
I do not have any more questions.
You don't have any more questions? All right. If you could please sign the bottom of that sheet if you agree with the following statement. I have had all my answers. Sorry. Let's start over. I have had all my questions answered, and I hereby acknowledge the above and give my voluntary consent to participate in this health and exercise evaluation. So if you agree with that statement, could you please sign there? All right. Cool. All right, let's move on. I know previously I had you fill out the health history form. I have it right here. Let's just go over that real quick just so we're on the same page. We can talk about anything that you feel like you need to tell me just so I know. Like I said, just be as honest as you can. That way I can help keep you safe, not only during the tests, but also whenever we do the exercise program. So, it says here you're a student?
Yes.
Okay, so you go to Tarleton?
Yes.
Okay, cool. And you're not taking any medications? Are you taking any medications?
I just take over-the-counter like Claritin,
Okay.
and then I have prescribed birth control.
Okay. You take Claritin every day?
Claritin I have to take every day, or
Okay.
I suffer from seasonal allergies.
Okay, and I see you wrote down seasonal allergies, so
Right.
Do you have any food allergies or?
I do have some food allergies. I'm allergic to tree nuts, which
Okay.
is, if you didn't know, it's like pecans and like cashews,
Okay.
almonds, all of those things. And also cantaloupe, watermelon, pretty much melons
Okay.
in general.
You're not allergic to any materials such as latex or rubber or anything that we might
No.
have in the weight room if we're doing
No,
stuff?
but I do have to ask, like, if we do anything outdoors,
Mhm.
I'd like to not have to touch the grass with like my hands
Okay.
or arms or anything because I'm very allergic to grass.
So no bear crawls?
Yeah, not on the grass anyway.
Okay. All right. Cool. Down here on your activities, you currently exercise, correct?
I do.
Okay. And it says you do elliptical, stair stepper, and treadmill. And you do it quite frequently, 3 to 4 times a week?
Yes.
Okay. Do you enjoy cardio or?
I very much enjoy cardio. Now that I've gotten to a point where I can do it more, because I've worked up to being able to do it longer and longer.
Okay.
And so I can handle it.
Okay.
I like doing that.
How do you feel about weight training?
Actually, that's gonna be one of my goals. I've done a lot of cardio to get down to my weight because I went from 190 to about 182.
Okay.
And so that's gonna be one of my goals. Is now that I'm down to the weight I want to be, I would like to show some tone.
Okay. Awesome. That's a good goal to have. You didn't list anything for recreational activities, so do you play maybe frisbee or sand volleyball every now and then, or?
Not really. I mean, today I played basketball, but that's not something that I do
Okay.
all the time.
All right. Down here on the medical conditions, you listed no on everything, which is good. And down here on your family history, it says your dad had a heart attack at 48.
He did. He had a heart attack before he was even 50 years old.
Okay.
And he has high cholesterol, and he takes baby aspirin, and has regular checkups with his doctor. He actually had to have a stent put in his heart because it was 100% blocked.
Okay. Well, it's good that we know that, and we'll be sure to keep an extra close eye on that whenever we're working with you.
Yes, he has heart disease, so I have to make sure that I stay healthy so that doesn't happen.
Okay. On the next page, well, it says you're not pregnant, so that's good. Don't have to worry about anything of that. You haven't had any major surgeries at all? Okay. On your exercise goal, it says you want to gain more muscle, which you just talked about, so we can work on that. And you enjoy cardio and Zumba stuff?
Yes, I like the Zumba classes at the rec center.
Okay.
I usually go.
All right.